Good morning, good afternoon. Welcome to the Los Angeles County DRC updates. I apologize, my microphone was not working. You guys saw me advance the slides here. So my name is Jason Belton. I'm the Director of Emergency Preparedness for CAF. Now, let me go back up one slide so you know where you are and why you're here. This is the Los Angeles County Emergency Preparedness updates. Where we take updates and information from the DRC meetings, try to collate all that and bring it to you in a quarterly webinar. Today is June 22nd. It's 10 a.m. in the morning, Pacific time. Once again, my name is Jason Belton. I'm the Director of Emergency Preparedness. These are our other program coordinator and our program manager. Unfortunately, neither one of those folks can be with us on the call. Mary's attending a meeting with FEMA for me, and then BK's attending a meeting with the county. So I won't have either one of those folks, but I do have plenty of information to cover this afternoon or this morning. So objectives for today, we'll discuss the DRC, CMS updates, the state updates, discuss the upcoming Mercy exercise in November of 2023, and that's important to note. And we'll go over what the CMS has said about exercises and things like that for 2023, because that's important. You'll want to make sure that you're joining us for the Mercy exercise in November. Anyways, and we'll review other upcoming trainings and webinars, potentials for you guys to learn more about disaster and emergency preparedness. All right, so some of the traditional acronyms that we use in emergency preparedness, we leave on a kind of a standing list. So if I mention any of these, when I say DRC, you know what that means, or when I say, the MAC or NICS or something like that, you understand what I'm referencing. All right, so we've got roughly 400 SNFs in Los Angeles County. It's about 383 or somewhere around there. In any case, this is where you're located across the county boundaries. The DRC locations are located throughout the county. And there's one DRC that's dedicated towards pediatrics, and the remainder of them are the DRCs in which we would be participating with. So think about your HVAs and your exercises, tabletops, things like that. You'll do those with your disaster resource center. All right, and so if you're not familiar with how to get a hold of who or your DRC, or we put a list of all the contacts for the DRCs up here. So we've got their email addresses, a primary and a backup in most cases. These folks are happy to help answer questions. They certainly need a copy of your completed HVA every year to help build their coalition HVA. So there's both an opportunity to engage and learn from these folks, but these folks also need something from you to help build that community-wide HVA that you will also need for CMS, for your emergency preparedness survey. All right, so we've got Kaiser Hospital, Los Angeles, Region 1. The contacts are Adam Richards. Adam's still there. He's a great, just a fantastic help. UCLA, Cedars, Ryan Tuckmeyer is fantastic at Cedars. He's still there, happy to answer any questions. He's about as knowledgeable as they come. Same with Essence Wilson. She's still at Harbor UCLA. All right, Terry Stone and Scott Cossey are still at Henry Mayo, and Steve Shrub's still at Long Beach Memorial. Kellen Pack is now overseeing the disaster preparedness programs within the county. So she's actually working at the county now. So she's no longer there, but she's actually BK's boss now. So she runs the entire unit there. So congratulations to her on her promotion, and we look forward to working with her throughout the years. All right, PIH is there, Pomona Valley, Providence. Andy is fantastic. One of the most helpful people. Steve is fantastic as well. I know most of these folks, and these folks are really, really very helpful if you have questions, if you're new to emergency preparedness, you're kind of at a loss for what to do and where to go, how to exercise, things like that. These folks are very, very helpful. So please don't hesitate to reach out to the DRC coordinator that is closest to your physical building, not to your home or where you drive in from work, but actually where your facility is located. All right, let's hop to the updates as of 6/22. Most of you hopefully have heard about this by now, but in April, the ACDC unit of Los Angeles County Department of Public Health, so the Acute Communicable Disease and Control Unit, released their updated guidance for COVID-19, and there is a ton of stuff there. So there's new state, it updated the federal regulations as it references the vaccination requirements, updated outpatient COVID-19 treatment section that add symptomatic residents who, even despite a negative test, if they're suspected to have a COVID-19 based on their symptoms, that they should also be considered eligible for oral antiviral treatment. So that's an important one to note. SNFs must ensure that all staff, including frontline staff, undergo basic infection prevention and control training at hire and annually. This is on their website as well. And source control continues to be required for staff. I realize this is getting old, folks, with the masks, but certainly it's one of those things we have to follow. It's a health officer order, which means it's a legally binding order. So despite the fact that other counties have moved away from this, Los Angeles County has chosen to keep this in place. So it's important that we make sure that we're maintaining that. And there were probably a half a dozen more less substantial changes, but there were changes. Mostly they're into how you cohort visitation. There are some other things. They're not as substantial as these ones, but please click the link, go through the updated section. It's always listed up at the top, so you can see what were the changes that changed from the previous versions and the previous guidance. So it's very helpful. Even if we don't like it, the actual page itself is very, very helpful, and tons of information right from that one page. I wish more counties had the ability to do that because it's really helpful. All right. In terms of the medical response and surge exercise, that is what we're calling the statewide medical health exercise now. It's been rebranded. So the medical response and surge exercise for Los Angeles County is going to be on 11/16/23. We will have a participant webinar on September 26th of 2023. And that's where we talk about, how to participate with the exercise, and we'll go over objectives and things like that, and activities that you should be doing during the exercise. And then there's an evaluation webinar after the exercise is over to talk about lessons learned, best practices, and things like that. So if you have more questions about the Mercy exercise, or you need any of the exercise documentation, meaning you need the objectives, you want the scenario, you want actor cards, you want all the stuff that you could need for the exercise is going to be listed and on there, as well as all the previous years. So 2022's exercise material will be in there. So if you failed to gather it from last year's exercise and you need that for records, don't hesitate to go back into that link and you can download all that stuff. So we have not created all of the documents for the November exercise yet, or at least they're not completed. When they are completed, they'll go up on this website. So you'll want to make sure to bookmark this and make sure you come back to it to download that exercise information. The reason why I say that is because of this next update. So CMS, back a few months ago, released a QSO 2313 all that talked about all of the things that folks must do at the end of the pandemic. And it was not just emergency preparedness stuff, it was a number of other things. But within that QSO, there was an important point that I wanted to point out, that all inpatient providers and suppliers, so think hospitals, nursing homes, ICFs, inpatient hospice, LTACs, all of those folks are going to be required to provide a full-scale or conduct a full-scale exercise within your annual cycle of 2023 and an exercise of choice. So that's 2 exercises, one being a full-scale or functional exercise. That's what the Mercy exercise is on November 16th. And then an exercise of choice can be a tabletop exercise or anything like that. And those tabletop exercises, the recommendation is to do the tabletop exercise with your DRC leading up to the Mercy. And that way, when you do the tabletop, you kind of have talked through what's going to happen through the functional exercise, and it will kind of assist in you know, helping you make the functional exercise more impactful for your operation. So I suggest doing the tabletop exercise with your DRC before the Mercy. That way you'll get both of your exercises covered, and 2, you'll get better at doing the actual exercise that you're going to practice. So now that's not a requirement in terms of the tabletop. You could do another tabletop or a tabletop of your own choice. You could participate in a tabletop that CAF does. You could participate in a tabletop somebody else does, or you can hold and conduct your own tabletop exercise. And if you choose to do that, there are some options out there for you in terms of exercise plans and all of the material needed in order to do a tabletop exercise. We also have a recorded training video on how you put together a tabletop exercise, as well as how to do a functional or full-scale exercise. The training videos are available on the CAF YouTube page. So it's, you know, just do CAF. If you go to YouTube and search CAF, C-A-H-F, you'll be able to find that information. If you're already at the CAF webpage and watching this on YouTube, so you already know where that information lies, and it should be a part of this same playlist here. So definitely want it, if you're not confident in understanding how to do a tabletop or put together a tabletop or a functional exercise, or training videos for you. If you feel very comfortable doing that, we have exercise material. If you just need the actual handwritten material with a couple you know, different types of disaster scenarios, we have those available on the website. I believe we've got an active shooter one, an earthquake one, and a wildfire one. There may be some others up there. If for some reason you want to exercise a specific thing that you have identified within your HVA, you go, you know, I identified flood, or I identified EID, or emerging infectious disease, or I identified something else, and you want assistance in helping develop a scenario and objectives for that, don't hesitate to reach out to Mary or myself, and we can kind of walk you through some suggestions, or help you out with a scenario that's based on some real life situations. So happy to help with any of that stuff, but it's important to note, you want to make sure that by the end of this year, we're going to meet the needs, meet these 2 exercise goals. All right. So I want to talk about, we're right at the precipice of wildfire season in California, and so generally that doesn't start until a little bit later in Southern California. It usually starts in Northern California, and as we get later in the year, it gets worse in Southern California. But California has recognized and realized that wildfire smoke is it's a very real hazard on both the outside, obviously if you're outside in air, but how it actually impacts indoor air quality is important too. And so the Department of Public Health created a wildfire smoke guide. This is more high-level stuff for public health officers and officials, but there's some great information in there about best practice for what you can do for both minimizing risk outside and minimizing risk inside. The reason why I bring that up is because indoor air and indoor air pollution is going to, I think what we're likely to see is this is going to maintain or become much more of a focus for long-term care and skilled nursing definitely, but also other avenues of long-term care. So think ICFs and assisted living facilities, memory care, things like that. I think there's all going to be a real big push from a federal side to take a look at how we treat indoor air pollution. I know I've written an article that was that's going to be in the DPP newsletter this week about wildfire smoke and indoor air pollution and things like that. Hopefully you get a chance to read that and you've subscribed to the DPP newsletter. It's a quarterly newsletter with topics on emergency preparedness and disaster preparedness. In any case, it's one of the stark things that I learned researching the article was that the WHO has some pretty stark statistics about indoor air pollution, how many people actually lose their lives to indoor air pollution, whether it be through carbon monoxide poisoning or other industrial hazards and things like that. It's a staggering amount of people. It's in the millions every year. And so that is, it's very concerning. The problem is we don't have a silver bullet to kind of immediately drop that. What we have is a combination of layers and best practices, almost like Swiss cheese, where you put a layer on top of a layer on top of a layer on top of a layer, and then hopefully enough layers you don't have any holes through the cheese, right? So those things are all contained within kind of that wildfire smoke guidance, but we've created some other training videos on kind of similar things, one being the HVAC, the other one being the airborne infection isolation room. So understanding how air moves within the building, and how we also have one on wildfire smoke as well. And so all of these training videos are located at that link to CAF TV. And they're not long. They're meant for your maintenance staff primarily. Some of them, like an infection preventionist, or an administrator could definitely learn from these, and you could kind of determine where you might have some risk exposure within your building for all of these things, whether it be mold or Legionella or water incursion or your HVAC unit and how you deal with outside air. Anyways, all of that stuff is becoming more and more important for the federal government. As a part of that research for that article, we also talked about President Biden and the White House created a panel on indoor air pollution, and they released a number of findings and recommendations that they recommend going forward. And a lot of those have to do with changing, or at least large changes in the universal model code, which we use to help guide states to develop building codes. And California is right at the lead of that. And so if anything happens nationally, you can expect California to be either first or right up there at the beginning with anybody changing to more prescriptive built environments, where we'll be required to have many more air changes per hour in our HVAC units. And so I think what we're likely to see is if you're building a new building or you have to remodel an old building and you're having to address these issues, you're going to have large infrastructure changes as opposed to small infrastructure changes, I think, in the future. So that's something that we anticipate we'll see in the next probably 10 years manifest itself. It could take less time, but generally when we see stuff like that, for an example, in 2008, we had a really bad year in terms of fires in nursing homes. And in 2013, we finally saw a law and a regulation passed that required every nursing home in America to have sprinklers in it. And so it was in 2003 that the fires happened. 2008 is when the law passed. 2013 is when it actually went into place. So the average is when there's a knee-jerk reaction or something like that, we generally see 5 to 10 years from now, we'll start seeing these things play out in model codes and things like that. All right, let's move on to the next one. In terms of upcoming trainings, folks, if you didn't know, ReadyNet is the primary point of contact for the MOAC in Los Angeles County and the Medical Alert Center. So in any time there's a disaster in Los Angeles County, you're going to need to be both logged into ReadyNet, and you're going to need to be responding to both bed polls and service level polls. And when I say a bed poll, that just means how many beds do you have open? Male, female, Medi-Cal, Medicare, or long-term, short-term? Do you have any vent patients? It's a pretty simple question, and you're just going to put in numbers. It doesn't mean you're going to get somebody, evacuated to you, but it does mean that we, meaning the folks at the county, need to identify open spaces as quickly as possible. And then the other thing is where they'll send out what they call a service poll, which means that you just need to respond and let the county know how you're doing. Are you okay? Do you need some help? Are you, and it's generally a color-coded system. So green, okay, yellow, we're okay, but we can't take new patients. Red, we're not okay. Black, we're evacuating. That kind of stuff. And it's really quick and simple, but it does require you to be logged in. And in order for you to be logged in, you have to sign up for the account with ReadyNet. If you've not signed up for the account, you can do that by emailing the folks at ReadyNet. You can also go to their website and sign up. There's training videos and a user guide. If you want to watch a webinar on how to sign up and how to work within ReadyNet, there's the next webinar, and they do these monthly. The next webinar is August 16th from 10 to 11 in the morning. And you can, the training videos on that link there also, I believe, are just a recording of the what's going to come out on August 16th. It's a standard kind of webinar that they give for all folks that are new users to ReadyNet. So if you're a new user, this is perfect for you. If you're an advanced user, I would, I haven't seen any advanced users yet ReadyNet, not in our space, definitely from the hospitals, but not in the SNF space. But if you are, and if you have recommendations for things that ReadyNet can do better, please reach out to us. Since this is a system primarily set up for hospitals, there's always work that can be done to improve the skilled nursing facility experience. So let me know if you see stuff that we need to change. All right, and then by email notification, if your emails, if you're not receiving emails from ACDC, and especially given the last few years, it's really important. Reach out to those folks, let them know, and say, "Gosh, we need to be updated when ACDC sends out these links or these updates to the COVID information and things like that." So, really important. If you're not getting it, this is an easy way to get put on their listserv so that you get all the information. All right, let's talk about this is this is more of a conference rather than a training or webinar. Obviously, there'll be trainings at the conference, but there's a lot more at the conference besides just training. So the CAF 2023 Summer Conference is July 16th through the 19th and down at the Westin San Diego Gaslamp. There's a link to register if you'd like to register. In terms of topics that we will cover, that's material for those folks that in emergency preparedness or that are doing emergency preparedness, is we will have a session called Think Like an Incident Commander, where we talk about objective setting during disasters and exercises. So that will be very helpful for those of you that are leaders at your facility, whether a DON or an EIT or an administrator. Or an executive director or anything like that. So this is mainly geared for those folks that are going to fulfill leadership roles in disasters. And then we'll have a 2-hour class on the 96-hour fuel supply requirements and alternate source of energy for safe temperature requirements. That was a piece of legislation that passed. I will talk about that on the next slide, but we'll have a class on that. That's an in-person class. It's going to be a 2-hour class where we talk about both the law as it stands and the solutions that can be utilized. So both here are the problems and here are potential solutions. So my hope is that by the end of that 2-hour session, every one of the attendees will walk away with a good idea of what their plan is going to be compliant with the rule. And so the rule I'm talking about is AB 2511, a piece of legislation that was passed last year and signed into law by the governor. Goes into effect, well, it's in effect now. The requirement is to be completed by the end of 2023. So by January 1 of 2024, the expectation in the legislation is that everybody will have become compliant by that time. Compliance in this instance is it's not an easy thing to comply with for most folks. So there's a requirement in the bill that you store fuel for 96 hours. We've talked about that. If you cannot store 96 hours of fuel on site, either for whatever reason, let's just say, you know, you've got 72 hours of fuel on site, that's fine. Got 54 hours, that's fine as well. What you need to do is, if you have anything less than 96 hours, provided you have more than a minimum of 6 hours on site, for anything between that 6 and that 96 hours, you will need to have a signed memorandum of understanding or memorandum of agreement with some outside entity that provides fuel delivery services to come refill or refuel your generator. And so if there's a gap in between what you have on site and 96 hours, you're going to want to make sure you have that at a minimum. And so my suggestion is for everybody, regardless of how much fuel you have on site, you could have 96 hours or 120 hours. Find a fuel delivery provider, somebody that delivers diesel fuel, and you'll want to make sure that you sign an agreement with those folks, because 96 hours is just a guesstimation. We don't know if there's a large earthquake, how long it will take to have you realistically be resupplied. And so that's why there's a 96-hour goal, and that's kind of what we attempt to attain and keep on site, because we think during a large, especially earthquake, where infrastructure and transportation could be really negatively impacted, in those cases, it may be difficult to get you resupplied within that time. Now, there's one thing, you know, there's two things. So one, if you need to be compliant for the rule, then the MOU will work, and that gives you paper compliance. But if you plan on that and you think that is going to be a rock solid option during an earthquake, I promise you it's not. It is, there's only a handful of those providers out there. In our county, we've got 10 million people. We've got thousands of healthcare facilities. We've got hundreds and hundreds and hundreds of businesses that rely on these fuel delivery providers to support them during their emergency. So just think, those folks, those limited number of people, are going to be moving fuel all across the county, and we may not be prioritized for that fuel. The OES department or the public health department or the EMS agency or fire departments or a police station or the jail or you name it, any one of the nearly 100 hospitals, right? So you take all of those folks, they're all utilizing those same vendors. So will it be realistic to think that we could go that long, during a disaster or during a large earthquake? It may not be realistic. So I would at least, try to think about backups. If I could not house 96 hours of fuel on site, I would definitely have more than one MOU. That would just be me, and I would have in my business continuity plan, I would list out, I would try to find every fuel delivery vendor that's remotely close to me. Even if it meant reaching outside of the county, to Riverside or to Orange or to Ventura, depending on how close you are to those jurisdictions. It may be easier for you to pull resources from that jurisdiction rather than from within LA County. So those are all recommendations. that's the easy part of being compliant with this law. The hard part is the safe temperature requirement. And so the law, as it stands, essentially says that alternate source of energy has to provide for safe temperatures during a disaster. And so if your HVAC is not connected to your generator, and your generator is not sufficiently sized, or your transfer switch is not sufficiently sized to support adding your HVAC units onto the load of the generator, then you'll have to do one of three different things. And I won't go on to them here because we're going to talk about them at this webinar, but as well as at the conference. But you're really going to have to either A, buy a new generator, B, buy a second generator, or C, install a microgrid. Those are going to be the three most common solutions. There may be options in which your physical plant can meet the existing needs with a little bit of modifications where you wouldn't have to do any of those things, and that's great. I hopefully you have either contracted with somebody to come in and take a look at your facility and give you an assessment of how they think you could be compliant, or you've had your maintenance staff go through the assessment form from HCI/OSHPD, and you go, hey, you know what? We could add load to our generator, but our transfer switch doesn't support it. So we just need a transfer switch. We don't need any of this other stuff, and we can get it covered. That'd be great. And I've talked to a number of maintenance folks that have identified this for their facility. And in those cases, just think, just that identification saves $400,000 or $500,000. So if you don't have to do a generator, that's fantastic news. So there are other options for those that are in a coastal community where you do not have central air conditioning, meaning your building does not have air conditioning at all. If you do not plan to add air conditioning just so you can put it onto your generator, then you're going to need to justify why it is safe for you to operate without air conditioning, meaning can you maintain internal temperatures between 71 and 81 consistently because the outside temperature does not get hot enough to raise the inside temperature. I realize it's probably a real limited subset of facilities, but there could be some facilities right on the coast that maybe could justify not having air conditioning. But we've seen folks even a mile or two inland in recent years, folks are getting hotter, and we have seen folks in coastal communities have multiple 90-degree days in a row. And if you have that without any internal air conditioning, depending on how well the building's insulated, it's more than likely you're going to exceed that 81 degrees, which is the maximum set in the legislation. So if you cannot maintain those internal temperatures below that, into that range in which CMS has said safe and comfortable is 71 to 81. If you cannot maintain that temperature, then you're going to need to explore those other options to do that. If you can justify that through, some kind of thing that shows climate, does not impact you, I don't think it's going to be a realistic option for most folks in the county. There will be some, maybe a handful that can do without air conditioning, but it's not many. The folks that don't have air conditioning, that don't need it, are mostly located in the northwestern portion of the state. Think Crescent City, Eureka, where it very rarely gets above 60 degrees outside. Now, they have the opposite thing, where we want to make sure their heating is fully operational 24 hours a day throughout any disaster. All right, so we'll discuss all of that, both the requirements and the in-depth solutions at our webinar and at the in-person conference. I really encourage you to do the in-person conference because we're going to have contractors there that both do microgrids and generators. And microgrids are a renewable energy solution with way less upfront CapEx or capital expenses for you guys. And so this is probably the most advantageous. So I would encourage you to attend just so you can learn about the microgrid component and how that may even save you some money on the back end in terms of saving costs on your energy expenses. All right. And the last kind of conference I wanted to talk about is the Infection Prevention Conference. That'll be in Pasadena, August 15th and 16th. We'll have a number of classes there. I will have one class for me there, but there's a number of other great speakers. Please encourage your infection preventionists to attend, especially since it's going to be within the county. So, all right, let's hop to our last portion here. Or the last training anyways, and I want to talk about the Great Shakeout. Now, while this is not a specific training, the Great Shakeout happens every year. This is an opportunity to exercise or drill your earthquake response. Obviously, the drop, cover, and hold happens on a specific date every year. But if you want to do like an exercise, how do I create an exercise out of the Great Shakeout and use that rather than something from the county or the state that tests a scenario I'm unlikely to experience. And that's quite common because the exercises that we write for the state or for the county, the scenarios are based on a list, a prioritization list that's given to us from the federal government. So they say, look, here, for the next 5 years, we want you to do these 5 exercises. Doesn't matter what year you do them, but you have to do these 5 things in the next 5 years. And so we're dictated or are mandated to do specific types of exercise. Most of that time, we have to try to really finagle it to get it to be something impactful for a skilled nursing facility. I know a lot of times it just is not impactful or a good enough scenario for you to exercise. So that being the case, earthquake is always a risk in California. It doesn't really matter where you are, but especially in Los Angeles County, it's a very, very big part of what we should be planning for. So if you wanted to use the Great Shakeout as an opportunity to exercise, I highly, highly, highly encourage that. We have created, I'm on one of the Great Shakeout committees. We've created some how to participate documentation, like, how do you make it an exercise, as well as information on exercise documents and things like that that you can download for free. All right, so lastly, I want to talk about the Cal/OSHA ATD standard, and this is something that came out, and Cal/OSHA mentioned this on a webinar from CDPH, and I don't know if everybody or if anybody was listening to the webinar. It is recorded, and it's on HSAG's website. I didn't include the link here. I apologize. I just now remembered that they record these, so if you need the language, him saying what I'm about to tell you, make sure you keep a copy of that. The slides themselves did not include any of this in writing, but I pulled this information directly off the Cal/OSHA website. So for skilled nursing facilities that do not transfer suspect or confirmed COVID-19 patients, meaning most of you are not transferring anybody with COVID out. Maybe a few of you have a relationship with a hospital where the hospital says, sure, I've got an airborne infection isolation room, go ahead and send them to me. 99.99% of everybody else is not going to do that. And so what happens when we cannot transfer these folks out? So by law, we're all referring providers, meaning we should be transferring anybody with an aerosol transmittable disease. COVID is one of those. We should be transferring them out to somebody with an airborne infection isolation room within 5 hours. And that's what's in the law, and it's been in the law for just a very long time. But there is some language in the law that says if that is not feasible or it's not possible, we know in this instance, no hospital is going to take somebody unless they're acutely ill, not just for COVID isolation. They're not going to take them for that. And so we're going to hold these folks in-house. So what happens, how do we do that? One, I highly encourage you to click the link because this is where I got the information from. And I would keep a copy of this. If any surveyor has a question about the activities that you are taking, you are only following the law. And so this is for employee safety, and it has very little, if anything, to do with patient safety. And so a lot of times they might conflict. And so you have to make sure that you can explain to a surveyor if they take issue with how you're treating and how you're implementing your actions. Say, I'm following this guidance from Cal OSHA, and this is what I need to do. If you want me to do something different, then you and Cal OSHA need to figure it out. But I'm not going to do that. I'm going to follow what the law says. All right, that being said, move the patient in a timely manner to an airborne infection isolation room. We know most of you that do not have that. If you have one, great, that's where you're going to put those folks. If no, which we're going to assume is everybody, you're going to consult with the local public health department, not CDPH, sorry. It says CDPH, but don't call CDPH. If you call licensing office, they're going to ask you, why are you calling me? Call the folks at ACDC, let them know that you have a new case of COVID, and tell them the level of separation that you're going to provide to that person. You're going to say, I don't have a single room. The person is in a 2-person room now, and I'm considering the other roommate exposed, and I'll monitor them for symptoms and test them, obviously. But that person's going to stay where they are. We're going to try to keep them if we don't have a private room. Now, if you've got a private room, go ahead and put them in the private room and keep the door closed if you can. Not every resident does well with doors being kept closed, but if you can, to the extent possible, keep the door closed. And then the last part is the part that is going to be hard to achieve with portable system to create negative pressure. Now, on the webinar, he did not say you have to create negative pressure, but he did say you had to have a portable HEPA filtration unit. Now, a portable HEPA filtration unit can filter the air, but it does not create negative pressure. In order to create negative pressure, you need to duct where something comes from the inlet from the HVAC system ducted into the machine. The machine filters the air, cleans it, and it's ducted back out through your return vents. And so there's not really any kind of negative pressure that's created by just placing one of these machines in a room. And so I'll just say it's possible. It could, because it's moving more air, it could create actual positive pressure, which is actually forcing more air outside of the room than would be normal. So it's not the same, but basically he said that the standalone HEPA filtration unit would work. So I highly encourage folks to go ahead and listen to the webinar if you want more information directly from Cal OSHA's mouth. You can always, Cal OSHA has a consulting branch that's free, that's separate from their enforcement branch, and you can always call those folks with questions. So that they do a lot, and it doesn't have to be just about this particular thing. If you have questions about what goes on an OSHA 300 log, or is my eyewash station appropriate? Things like that, or is my injury illness prevention program adequate? What are my requirements under the workplace violence rules, things like that. So any questions you have about Cal OSHA, they're usually pretty good about answering those questions from a customer service focus. Does that mean that if you identified yourself as a facility and said and self-identified define or deficient conditions, I would never do that. I would just call and ask hypotheticals as the best practice. We don't want folks showing up at your door a day after you've called to ask the consultant some questions. So, all right, that being said, hopefully answered all your questions. I don't see any questions in the chat box, but I'll give it one more second because I'm still a little early. We're only 45 minutes in and we had an hour scheduled. Well, I don't see any other, I see some comments in the chat that I won't mention, but no questions. All right, so that being said, if you do have questions after this, or if you're watching this on YouTube and after the fact, my email address is there, my phone number is there. We have a number of resources that are dedicated to just Los Angeles County, and that's where you can find those resources. And then this video should be up on YouTube within by Monday. So it's actually today's Thursday, so tomorrow I should have it up on YouTube. It takes a few hours to download it and then upload it back to YouTube. In any case, hopefully everybody has a wonderful rest of their week, has a wonderful weekend. We will talk to you in 3 months from now. Take care. Thanks.